Hi, this is Tim Mitchell with another episode of the Mitchell's Minute. Today, I've invited my son, Tanner Mitchell, to be our guest on the Mitchell's Minute. Tanner, you want to tell us about yourself?
Yeah, my name is Tanner Mitchell, and I'm a second-year pharmacy student at UMKC School of Pharmacy. And I was wanting to talk today about some insomnia.
Okay, yeah. I think it's a great topic. A lot of people have questions about insomnia, and just keep in mind that anything we say, make sure you talk to your doctor or your nurse practitioner or any prescriber ahead of time before you take any of these recommendations. Just kind of a safe disclosure. Also talk to your pharmacist about any questions you might have. But anyhow, Tanner, do you want to tell us a little bit about insomnia?
Sure. So insomnia is actually a very prevalent issue. So what insomnia is, just broken down, is just any issues of having trouble falling asleep, staying asleep, or maybe just getting a good night's rest. Insomnia is so prevalent, it's estimated that about 64% of people have symptoms of insomnia about twice a week. So it's very common, and especially nowadays with everything that's happening with the virus concerns and everything, with people not being able to get out of the house and not being very active, and then maybe some anxiety concerns. I'm sure that insomnia is very prevalent right now.
Well, that's great information. So, Tanner, if you can tell us a little bit about what people might be able to do, maybe some over-the-counter items, or actually maybe non-pharmacy things. Can you tell us a little bit about that?
Yeah, so for insomnia, the most important thing that we try to focus on is non-pharm therapy, and pretty much that's just improving your sleep hygiene initially. Of course, after that, you can always tack on some medicine if need be.
That's all right.
So what we want to focus on right now is the non-pharm techniques. All right, so first thing that we like to talk about is just using your bed mainly just for sleeping purposes. This helps keep it a relaxing environment, especially with everybody working at home nowadays. Some people may be working in their bed, and what that's doing is just wiring your brain of when you get in the bed to start thinking and turning on your brain. So maybe it might be a good idea to maybe use a desk or a different room that you have to work on that stuff, and then only keeping your bed for sleeping only. So the next thing would just be keeping your bedroom as comfortable as possible. That could be by implementing keeping your bedroom at a comfortable temperature, minimizing any light distractions or things of that sort, and then making sure you're not using your electronic devices around bed, because once again that could stimulate your brain activity as well. All right, and the next thing that we can implement is just keeping healthy sleeping habits. A main way that we can implement that is by going to sleep at the same time every night, and maybe waking up at the same time every day, even on weekends. That can help adjust your sleep pattern there. And then alongside, if you're having trouble sleeping at night, it's important to not keep trying to tell yourself to go to sleep, because that can cause you to stay up. Maybe get up and engage in some relaxing activities to help calm you down a little bit until you feel tired, and then try going to bed.
Okay. So if someone tries these sleep hygiene techniques and they don't seem to work, of course, they may want to talk to their pharmacist about what can help them. What are some what are some medications or over-the-counter type things that they could use, maybe without a doctor's prescription?
Yeah, so there are a lot of sleep over-the-counter items that we have. Some of them are Benadryl, which goes by diphenhydramine. There could be melatonin or doxylamine. One of the ones that I like to recommend the most is Benadryl. So how this medication works is it works on the histamine receptors, which typically activate your brain, and it blocks these, promoting some sleepiness for you. So Benadryl, also called diphenhydramine, comes in various forms. It's all the same thing, but you could see it as just Banafen, diphenhydramine tabs, Benadryl tabs, or ZQuil as well.
And ZQuil also comes in like a liquid, and I think like a quick dissolve tablet or something as well. So does a quick dissolve tablet get into your system a little faster? The liquid get in faster than a normal tablet, or how does that work?
Yeah, so the quick dissolve tablet and the liquid will definitely get in your system a little bit faster if you do note that the Banafen or the regular diphenhydramine isn't working for you.
Okay. So if the over-the-counter medicines don't work, then what's the next step?
The next step from there would be prescription therapy, talking to your doctor and them getting you a prescription for something for sleep.
All right. And there's lots of options there, of course, and I think it's important for people to talk with their pharmacist and your doctor. Appreciate Tanner for taking the time today to come talk about insomnia, and there's a lot of things going on right now. We appreciate you, watching this episode of Mitchell's Minute. We look forward to seeing you next time. Thank you.